This video is by Straight Goods News, SGNews.ca.
Parliament continues to function that way.
On the generic drug bill, your government made history when you passed it was called Chrétien's Drug to Africa bill, but when you passed the first bill, you got a WTO exemption. But there's only been one or two cases of a generic drug maker ever exporting it. Even if it's a private member's bill, how much of a shame would it be if this bill dies yet again in an attempt to improve the legislation?
Well, I think the fact that it's a very well-intentioned measure. It's a measure that I think speaks to a deep sense of humanitarianism, which I think you'll find across political parties when it comes to necessary access to medication. As I was saying in the House today, we have issues of access to medication in our own country today, so we need to focus on that as Canadians. But I do think it's also a fact that there are generic products and there are products being produced in many different countries, Brazil, India, all around the world. Whether we can make the cheapest product or not is we just have to see. But I think it's worthwhile for us to continue to make the effort as Canadians to do what we can to deal with some medical crises that are taking place in Africa and Asia that need to be responded to.
What are we supposed to make of Stephen Harper's response on the health accord?
What I make of the response in the health accord is that the Prime Minister doesn't give a fig about health care. He doesn't think it's a federal responsibility. And I think when he says it isn't a federal responsibility, that will come as news to a great many Canadians who think it is a federal responsibility or a shared responsibility between different levels of government. It's a compact between Canadians. And it's a compact which he is breaking by the ideological approach which he's taking.